One of the most common problems we see in throwing athletes is what we call a slap tear. This is an injury to the superior labrum anterior posterior. It's where the biceps actually attaches to the very top of the socket. We can actually try to find out and figure out if they have the slap tear through a series of different examinations. Jed Kuhn from Vanderbilt University actually developed a wonderful evidence-based mechanism of ruling out the presence of slap tear. And what you do is you do 3 specific tests. We want to do abduction and inferior distraction. So I'm going to hold his arm abducted. I'm going to push him inferiorly. If that causes pain, that would be 1 positive finding. I'll do an inferior sulcus test. I'll pull him inferiorly. If that causes pain or problems, that would be 2 positive findings. And the third is resisted supination, or a Jurgensen's test. Resist your hand, palm up, keep going all the way up. And if that causes pain in his shoulder, that would be the 3rd positive finding for a slap tear. What Dr. Kuhn has shown us is that if all of these tests are negative, the likelihood of having a slap tear is only about 6%. You don't need to do anything else for your athlete. If 1 is positive, any one, then you have about a 15% chance of having a slap tear, and you may want to consider getting an MRI scan. If 2 are positive, the likelihood of having a slap tear is 35 to 66%, and you probably need to get an MRI scan that's about 90% accurate in diagnosing a slap tear.